Welcome to the Greater New Bedford Community Health Center. We will be presenting a series of seminars which we hope will inform the community and our staff about the benefits which are available to the people that we serve. The first series will cover benefits which are available to senior citizens, and the first of the series will be presented by Mary Bessie, Shine Counselor, who will discuss prescription plans that seniors can choose from.
I would like to welcome Mary Bessie from the Shine program. This is the first in a series of many lectures that we'll have concerning benefits and things that are available to the populace at large, specifically the elderly. And so I want to welcome you today. Thank you very much.
Thank you very much. Hi, I'm Mary Bessie. I'm the Regional Director for the Shine program. My office is located at the Middleborough Council on Aging, and I service all of New Bedford, the surrounding towns of Acushnet, Fairhaven, and Dartmouth, and all of Plymouth County. I'll give just a little history about us here, or who works with us. I have 47 counselors that are trained and certified through Elder Affairs. Their training is an 8-hour day, 12 days. They learn all about Medicare, the different health programs that are out there, Mass Health, all of those different things. And like I said, we have 47. We have 6 counselors here in the New Bedford area in the surrounding towns. And I'll let you know where they are toward the end of the presentation. The Shine program. What does Shine mean? A lot of people say that. Shine, what is Shine? Shine means serving health information needs of elders. What we do is we give free health insurance information to seniors, to anybody who's maybe looking to retire, someone who is already retired and they're on Medicare, or even those that are on Medicare under 65 and disabled. We help all those people. There are 14 of us directors in the state of Massachusetts. There's approximately 489 trained counselors. We all have at least another 6 to 10 counselors that are newly trained every year. So you can imagine that this goes up quite a bit every year. We're lucky enough to not lose any. We are administered by the Massachusetts Office of Elder Affairs, coordinated with the legal agencies. I'm going to talk about Medicare. We'll start off with that. There's 4 parts to Medicare. There's A, Part B, Part C, which includes your HMOs and PPOs, and Part D, which is your prescription plans. Part A consists of your inpatient hospital care, any skilled nursing facility. It will also pay for home health care, hospice care, and blood. Part B services are your doctor's services, if you were to go to the doctors or if you needed an x-ray or any types of lab tests, ambulance transportation, artificial limbs, home health care. As you can see, they're all listed right up there. And Part B only pays 80% of your medical needs. What's not covered by Medicare is your routine eye exams, any routine foot care, hearing aids, medical care outside the U.S. If you're in the U.S., you are covered. In dental care, it does not cover that, or dentures. Some of the preventive benefits: you will not pay a deductible or a co-insurance for most preventive services. These are things that you can get new this year, in the year 2011. When you go to the doctors, you will get a wellness exam every year. You can get cancer screenings, diabetes screenings. They've come up with all these free screenings because we want to keep our seniors healthy. So if we can give them this free care, some of our seniors have insurances that may have a co-payment, even if it's $20. There's a lot of seniors out there that just don't have $20, and we need to keep them healthy. We need to keep them at home and out of the hospitals. So these are just different things that they offer free that Part B will pay for. There are health plans to help fill the gaps in Medicare. For instance, Part A has a deductible of $1,132. If you were to have just Part A and you were to go to the hospital, you are responsible for that $1,132. Part B has a deductible of $162. So if you were to have just Medicare, nothing else, just Medicare, and you go to the hospital or the doctors, this is something you're responsible for. This is money that's going to come out of your pocket. And obviously, a lot of people just don't have an extra $1,000 or $100 hanging around. So what we do is we try to fill those gaps in Medicare. And if you can go and see a Shine counselor, we can help you with that. One way to fill a gap is to look at the Medigap policies. There's 6 policies in the state of Massachusetts. There's, if I can remember them all here, there's Blue Cross Blue Shield, Fallon, United Healthcare, Humana, Tufts, and I always miss one. Harvard Pilgrim, I'm sorry, is the other one. These are 6 plans in the state of Massachusetts that can help fill the gaps in Medicare. The only difference between these plans is what you're going to pay, is the amount of the premium. They all do exactly the same thing, so it all depends in price. One is the least expensive and one is the most expensive. I will tell you that Tufts is the least, United Healthcare is the most. But some people, depending on what they're satisfied with, is the plan that will help them apply for. There's 2 types of supplement plans. There's the Supplement 1 plan, and then there's a core plan. The Supplement 1 plan can be quite expensive for some people, and what this does is this will pay your Part A deductible. It will pay your Part B deductible. It will also, so that you will not be required to pay those. These Medigap plans will come in and pick up those expenses. Let me explain too with the Supplement 1 plan. The Supplement 1 plan will pick up all the 20% that Medicare doesn't pay. If you were to choose a plan like that, you wouldn't have any out-of-pocket costs. There'd be no deductibles to pay. There wouldn't be any co-payments. It pays fully. All you would be responsible for would be your monthly Medicare payment that comes out of your Social Security check each month. The core plan does not cover 100%. It will cover 100% after you have paid your Part A and Part B deductible. That's something you would be responsible for. After you have chosen your Medigap plan, you would need a Part D plan. A Part D plan is your prescription plan. It began in January of 2006. It was a voluntary program. It does provide prescription drug coverage to all Medicare beneficiaries. CMS is the Center for Medicare Services. They do contract with private companies. You'll find that you'll get a prescription plan with your Medigap plan. You would end up with 3 cards. You would have your Medicare card, you would have your Medigap card, and then you would have a Part D card. Okay, so when you went to the doctors, you would need to show your Medicare card, you would need to show your Medigap card or your supplement card. Then when you go to the drugstore, you would use your Part D. But that would be full coverage. We also have the Part D plans in with your Medicare Advantage plans, which is another way to help be covered when you get on Medicare. In order to be on Medicare, there's different ways that people apply for it. If you're on your way to turn 65, you can apply for Medicare at the Social Security office 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Or if you are under 65 and disabled, after being disabled for 24 months, you will pick up Medicare. There's an annual coordination election period, which is the enrollment period that we've all heard of, open enrollment at the end of the year. That's the time of the year when you can change your plans. In the previous years, it was November 15th to December 31st. This year, in 2011, it is being changed to October 15th through December 7th. That's the annual coordination election period, which is also called open enrollment. This is the time when you can come in and change your Part D plans or your medical plans. Then there's a special election period for beneficiaries who may have lost their coverage, or maybe you have a Medicare Advantage plan. And the time to do that would be between January 1st and February 14th. And all that does is you can disenroll from your Advantage plan, go back to your regular Medicare, and then pick up maybe a Medigap plan to cover that. There's also a Part D penalty, which is 1% of the premium for each month that a beneficiary does not apply for a Part D premium, for a Part D plan. Some people think, well, I don't take any medications, I don't need to be covered, I'm not going to pick up a D plan. Now these are people that are on Medicare that need to pick up a D plan. So if they decide they don't want one, that's their choice, but they need to know that there will be a penalty if sometime down the road they decide to pick one up because they've gone to the doctors and now they're on medication. So that would be a 1%. It's 1% of the premium for every month that they aren't, that they don't enroll. So we try to get them to at least enroll in maybe the least expensive plan, to at least get them through, just in case you get sick and need to go, just to avoid that penalty. We'll talk about the Medicare Part C part of Medicare, which is a Medicare Advantage plan. Those are your HMOs and your PPOs, your SCOs, your senior care options, special needs plans, and medical savings accounts. The medical savings accounts are no longer available in Massachusetts. Your HMOs in this area, in the New Bedford area, there's Blue Cross, Blue Shield, Secure Horizons, and Tufts. For the special needs plans, we have Evercare through United Health, and the senior care option plan would be Senior Whole Health.
Mary, I think it would be helpful if you just explain what exactly SHINE stands for.
Okay.
The purpose, the mission.
Sure. SHINE stands for Serving Health Information Needs of Elders. And what we do is we train and certify people that would like to become volunteers or SHINE counselors throughout the state of Massachusetts, or really we have counselors throughout the nation. They're nationwide. And we help people that are on Medicare with their medical needs.
As for training, is there any specialized training that the counselors have to go through? Maybe you want to explain something about that.
Sure. The training consists of an 8-hour day of 12 days. It's usually 2 days a week. And we go through a very large manual, which includes Medicare, Medicare Advantage plans, Medigap plans, Mass Health, long-term care, those types of things.
And what do they learn in the training?
They learn to deal with Medicare beneficiaries. They learn to be able to help them get the best products that fit their needs. Their pocketbooks, basically. There's a lot of people out there that pay too much money for different products. And it's just sad. It's too much. So what we do is we sit with them, we counsel them, we find out what best fits their pocketbook, really. Some people are paying too much for something, and we do this free of charge, unbiased information.
Now, how many counselors are there, and where exactly are they located?
Okay, there's about 489 counselors right now in the state of Massachusetts. All of us directors are in the middle of training, and we all train anywhere from 6 to 10. Maybe some have a few more. So they will also be added to that number. And they are situated in our our Council on Aging's or our ASAPs, like Old Colony or Coastline Elderly Services.
And Mary, you touched on it, but how do we actually help beneficiaries? Maybe you could explain that.
Well, if you were a beneficiary, and maybe you were looking to retire, you would come in, I would have you bring in your Medicare card, and I would sit with you, and I would explain the different products available to you, whether it be a Medigap. I would explain Medicare and how that works, because a lot of people don't realize how that works. Then I would find out whether a Medigap or supplement plan would best fit your needs, or maybe a Medicare Advantage plan would best fit your needs. It really depends on your health to what plan is best for you.
Yeah. What are some of the common questions that you'll be asked?
What's it going to cost me?
Sure. Yeah.
That's the big one.
Yep.
What's this going to cost me?
And the age group that we service.
Well, basically, they're beneficiaries 65 and older, those looking to retire, or those that maybe have already retired, or some people are retired and their retirement plan is changing. They're going to need some help. And we also help those that are under 65 and disabled. If they have Medicare, we can help. And there's also programs out there, too, that can help pay for some of these. For instance, there's a program out there to help people pay for their Medicare payment, whether it be 9640, which it was prior to 2010. In 2010, it was 110.50, and now this year, if you're looking to retire, it's 115.40. That's a big expense, but
Sure.
depending on your income, we can maybe, hopefully, get a way to get that paid for you. That's an extra $100 in their pocket.
Oh, absolutely. Now, are those the biggest changes in healthcare? Because you talked about changes. What other changes, if any, are there?
Some of the great changes are people are able to go and get a wellness exam or a mammogram or a colonoscopy and not pay anything. Whether they have just Medicare, they don't pay anything. Or if they have, say, an HMO plan or a Medicare Advantage plan, which would consist of a co-payment, they would not pay that co-payment.
Wonderful.
We need to keep them healthy.
And we need to keep them connected.
Absolutely.
So, how does somebody connect with a Shine counselor?
Well, basically, what they usually do is call or go to their council on aging. They may say something to a neighbor that has heard of us. And you can call the 1-800 number, Age Info, which is 1-800-243-2463. And that number there, the 1-800 number, rings in our regional office, which is located at the Middleborough Council on Aging. And we get all the calls for the New Bedford area and Plymouth County. So, and then if we say get a call for Pembroke, that someone's living in Pembroke and doesn't know where to go, we will send them, say, to the Pembroke COA.
Are there any other frequently asked questions that you may find helpful to include here that we could help disseminate the information?
Well, we work closely with our ASAPs. Like I said, either Old Colony, which is in Brockton, or Coastline Elderly Services here in New Bedford. If we get a call and someone might be looking for home health care, or we would have them call there and let them, we try to network with a lot of different agencies, whether it even be hospice.
Right. And finally, perhaps we have somebody who has a question that's pertinent and would like to ask anything. Are there any other questions?
So let's say that I'm actually seeing a patient and they already have Medicare. How do I help them from the office? How do I connect to you?
If you have someone come into your office and they're looking for help with their insurance, their medical insurance, they have Medicare.
Let's say they're not looking for help, I'm just trying to help them.
You want to help them because you know that maybe they're paying too much, and is there a way to maybe get them to pay less? You're going to take my card today and you're going to call me. Or you can call one of the councils on agings here in New Bedford. This is what we try to do, is we need to get out there and network with our doctor's offices. We need to get our pamphlets out there. We need to network with all the agencies because, drugstores, anywhere. What would be a great help too would be to have a Shine counselor here, which I think we'll be looking to do.
And that would answer the question of, how can we be of help, seeing that
Become a Shine counselor.
Mhm. And that the community comes to our health center here. We have become a focal point in our community
Absolutely.
to share this very, very important information.
How does one access your system if they speak a foreign language?
A foreign language, if I speak Portuguese or Spanish, how would I access it?
What I do is I will forward that call to, I have people that speak Spanish, Portuguese, Creole in the New Bedford area, and what I would do is, depending on what language you're looking for, I would connect you with that person.
Any other questions? And they were all excellent, by the way. Okay, Mary, on my behalf, thank you, and let me give you a chance to sum up and thank you for sharing this very, very important information with us.
Thank you. Thank you very much. I think I was in the middle of talking about Medicare Advantage plans. HMOs, PPOs, the ones that are available here in the New Bedford area. A beneficiary who has a plan can enroll or change their plans, like I said, during October 15th and December 7th. This is very important. You're going to see this a lot. I hope we hear it a lot. I remember last year we heard about open enrollment a lot on the TV and radio. I hope they do it again this year. If there's a beneficiary that has a Medicare Advantage plan, the only time they can change their plan is between January 1st and February 14th. We also help people with limited income. It's called LIS. What this does is this helps our beneficiaries with their Part D plan. It does depend on their income and their assets. And what we do is we do this through Social Security website. We take all the beneficiaries' information. What this can do is, depending on their income, it may pay the whole amount of their premium. They may only have to pay as little as $1.10 or $3.30 at the drugstore. There's a lot of people out there that don't realize that this is available to them or how to apply for it. But like I said, it is income-based and assets. For instance, if you're single and your monthly income is $1,381 or less, and your assets are $12,260 or less, you can get help with your prescription coverage. If you're a married couple and your income is $1,859 a month or less, or $25,260 or less, we can get you help with your prescription plan. That means we will get you help paying all or part of that monthly premium, which can be hefty depending on the plan that you're in, and help with your co-payments. Who doesn't need to apply for low income subsidy? Those that are full duals, which have Medicare and Mass Health, because it's automatically given to them, so they do not need to apply for this extra help. Some of the other extra help, Medicare savings programs. These are just initials, the QMB and the SlimB and the QI1. What these do is, again, it's income-based and asset-based, but these programs can help pay that Medicare, deduct the Medicare premium that you pay every month that automatically comes out of your Social Security check. We want to give that back to you. So we want you to, be able to apply for that also. These are all different programs that the SHINE program, those that are volunteers and counselors, can help our beneficiaries apply for. Another way to help with some of your Part D, which is your prescription plans, is Prescription Advantage. Prescription Advantage is not a prescription plan. This is a state assistance program only in the state of Massachusetts. We are very, very lucky to have this. Again, this is also based on your income, but not your assets. Your income as a married couple could be as high as $73,550, or a single person of $54,450. If your income is less than that, you need to apply for Prescription Advantage. What Prescription Advantage does is it'll help you in the donut hole. If you've all heard of the donut hole, that's when you've gone to the drugstore, and every time you go, they take the retail value of all your meds and they add it up. Once that amount reaches $2,840, you have reached the donut hole. Now it is going to cost you 50% of your medications. The next time you go to the drugstore, in the past you needed to pay 100%. This year, in 2011, it has been cut in half. You're going to be responsible for 50% of your medications. So if you've got a medication that's worth $200, you're going to pay $100. But if you are a prescription member, you won't have to pay that $100. You'll pay Prescription Advantage. You may pay $7. They're all income-based. There's 5 categories, depending on where you stand. You're going to pay as little as $7 for a generic drug, or $12 for a generic drug, or $18 for a brand name drug, and $30 for a brand name drug, depending on the category. But once you hit that donut hole, we have a lot of people not realizing that this is another way they can get help. And it doesn't cost them to be a member of Prescription Advantage as long as they fall within the first 4 categories of Prescription Advantage. If you fall within the 5th, which is the highest, there is a $200 fee. But we do have a lot of people that need that. They may be taking a cancer drug. They're hitting the donut hole the beginning of the year. January, February, March, it's worth it for them to pay that $200 to get help for the rest of the year. So Prescription Advantage, like I said, it's not a drug plan. It's an assistance program through the state of Massachusetts. Again, if you have Prescription Advantage, Medicare does not pay for benzodiazepines. Prescription Advantage does. So this is another help for those that are maybe even low income and can't get those meds paid for. Prescription Advantage will pay for them. Prescription Advantage has a website. You could reach them at 1-800-243-4636. You can reach a lot of our services through that number. You can reach the SHINE program through that number, Prescription Advantage, and Elder Services in Boston. Our Medicare beneficiaries have access to many choices regarding their health insurance and prescription coverage. And it's the SHINE program that can really sit down with someone and explain that to them, find out what they can afford, maybe what they can't afford. That's our main concern, is to help our beneficiaries. We need to help those that are on Medicare make the right choices. We want them to stay healthy. And these are some numbers in the area that you can call for help in the New Bedford area. We have SHINE counselors at all these sites. And that concludes my presentation.
Thank you very much. And the SHINE program, this is such a wonderful program to start our series with, because you learn today that there's a lot of things that are available in coverages and stopgaps for our most needy of population, the elderly population of New Bedford, Massachusetts, our friends, our family, us maybe. So I think that this is a great thing, and I can honestly say to Cruz Martinez, who's our Patient Access Director, we're going to be, and Diolinda Furtado, we're going to be working very closely in development and having the SHINE program available at the health center. Dr. Restituto, the head of our geriatrics department, is here, and we certainly see a lot of social pathos out there and people that need help, and what better place to help than a community health center, and the great group that we have here of local agencies that serve the elderly. Thank you very, very much. Appreciate it.
Thank you. Thank you.